Hey, it's Dr. Jared, and today we're talking all about shoulder pain, specifically rotator cuff tendonitis. I'm going to tell you what that is, why you get it, and most importantly, I want to share a simple routine of stretches and exercises that you can do right at home to help this common condition feel better fast. Now, what is tendonitis? Well, it's an inflammation or irritation of a tendon. Now, when we talk about it in the shoulder, we're typically referring to the rotator cuff, which is 4 small muscles whose primary job is to control movement in the shoulder. When these tendons get irritated, that is a rotator cuff tendonitis. The muscle that it most often occurs in, or more specifically the tendon that it most often occurs in, is your supraspinatus muscle. That's this one that sits right on top of the shoulder blade right here. The tendon comes down and it has to pass through this really small tunnel. You can see it right here. It has to pass through that tunnel to connect into the top of the humerus. That tunnel does not have a lot of space, and when it gets crowded, if the rotator cuff's not performing its proper function, or if there's not enough space in there, that's what can lead to this tendonitis. Over time, that tendonitis can result in some fraying to that tendon and eventually even a tear or a rotator cuff tear in that tendon. So it's important that we get on top of it early. It's important that we treat it the right way early to get it back to normal and healthy function again. That's exactly what you're going to get in this video. I'm going to show you some stretches to create more space in that area for that tendon to pass through, and then also some exercises that are just going to improve the motion at your shoulder to prevent injury from happening in the future. So stretches to help you to feel better now, strengthening to help keep that pain away, and between those two things, hopefully you start to feel a lot better fast. If that is the case, leave me a thumbs up on this video, comment your experience down below. I always love to hear from you. That being said, let's jump right in. The first thing that I always recommend you start with is a very specific type of massage to that inflamed tendon. This is going to be a cross-friction massage. It's a great way to stimulate healing and increase blood flow into that area of injury. What you're going to do is take 2 fingers, and the easiest way to find it is to kind of follow your collarbone, follow your clavicle all the way out. You're going to get to a point where there's just kind of a big bump right there, and then you should be able to fall kind of right off the edge of that. As you fall right off the edge of that bone, again, that's right where that tendon exits out of that tunnel. Typically, that's the spot where most people are really tender with this. And you'll be able to kind of move around, and as you find it, it kind of feels like a rope underneath there. That's how you know you're in the right spot. If you have an injury to that rotator cuff, this is probably a little tender as you find it. Now what you're going to do is push down, so push pretty hard, and then you're just going to move forward and back. So I'm moving back and forth, and I'm kind of feeling that rope kind of bump back and forth underneath my fingers. That's how I know that I'm pushing hard enough. Now with this, I tell people it's probably going to be pretty tender for the first 30 or so seconds that you do it, and then that should start to go away. If you do it for 30 seconds and it's still very painful, it might not be the best thing for you right now. We might need to get that inflammation under control a little bit more and then try to revisit this when it's in a little bit healthier condition. And so again, you're going to find that tendon, and typically what I recommend is about 60 seconds on this. You don't need to do any more than that, but it is important to be consistent with it. So about 60 seconds once a day is adequate. That's about what we need to kind of get that area warmed up. I always like to follow that up with 3 different stretches. They look just like this. I'm going to go with an external rotation stretch first. I've got a golf club right here. You can do this with a broom, a mop, a dowel, a PVC pipe, whatever you have laying around. You're going to lay down on your back with your injured shoulder, with your injured elbow bent to a 90 degrees. Let me correct myself. Injured shoulder, the elbow is bent to a 90-degree angle. There we go. Now, with the golf club, I'm going to put the head of the club right into my hand. This is my right hand over here. I'm going to keep my left elbow bent at that 90 degree, and then with this right hand, I'm going to use that to push that hand out. So I'm pushing my hand over towards you, over towards the camera, with my elbow bent in a 90-degree angle. And what you should feel there is a good stretch through the front of that shoulder as we push into this external rotation motion. Take it to where it's a comfortable end range. So if your shoulder is really irritated, if it's really painful, it might not be that far. Take it to where it feels like a good stretch. I want to go to pain, but not into pain. Hold it there for about 30 seconds, and then we're going to repeat that 3 times, is what I typically recommend. We're going to follow that up with an internal rotation stretch. And so now what I'm going to do is actually lay down on my injured shoulder. Some people don't like this position. If you're fully loaded on your shoulder, or if you're kind of closed down in this position right here, that is a lot of pressure on your shoulder. What you can do is just open your shoulders slightly. So open up towards the ceiling. That's going to decrease the pressure on your shoulder, hopefully make it a little more tolerable. Bring your elbow up and so that it's perpendicular to your body. Now in this position, I'm once again going to keep my left elbow bent. My right hand goes to the back of my left hand, kind of the back of my left wrist, and now I'm going to use my right hand to rotate down towards the table. So I'm using my right hand to push my left hand down towards the table while maintaining that 90-degree bend in the left elbow. Sometimes people like push it out here and they'll say, I don't feel anything. So make sure that that elbow is bent just like that. And what you should feel with this is a good stretch to the top of the shoulder, and you're gonna feel this around to the back of the shoulder in those external rotators as well. And so this is a great stretch to, again, just kind of create some more space in the shoulder. I take it to where it's just a comfortable end range. Hold that for about 20 to 30 seconds, and then you can repeat that 3 times. And then the last stretch that I like to do, or last stretch that I recommend for people, is going to be an inferior capsule stretch. So basically we want to stretch the bottom of the shoulder capsule kind of down here in the armpit. Basically, if this is the head of the humerus, it's crowding up into the top of the shoulder blade. I need to create more space down here so that it can move without that inflammation, irritation. And so this is how I recommend that you do that. What you're going to do is kneel down with your injured arm out in front of you with the palm up, so it looks just like this. Now with my right hand, I'm going to grab my left wrist and I'm going to anchor that down with my right hand. Now in this position, what I want you to do is sit down onto your heels. I'm even using my right hand to push my left hand in that direction. So I'm trying to create basically a traction force in my shoulder. I'm trying to just create more space in that. And what you should feel with this is just a good, comfortable stretch right here, kind of under the shoulder, like down in the armpit is where I typically try to get people to feel that one. And so you might have to kind of move your body around. You might have to adjust your shoulders just until you get that in a good spot. Hold it where it's a comfortable stretch. Hold that for 20 seconds and then repeat that one 3 times. Now, if you've been following along to this point, your shoulder's probably feeling pretty good between the massage and the stretching. The key is we want that pain to stay away, and we do that with rotator cuff muscle strengthening. This is the series that I like for that. Now, for these exercises, you will need some sort of resistance band. You can also use cables if you have access to those at a gym. If you don't have access to bands or cables, you can also do similar exercises with dumbbells. That's a different video that I've already recorded, how to strengthen your rotator cuff with just dumbbells. What I'll do is I'll link to that at the end of this video. Now, to demonstrate this, what we're going to do is anchor this band so that it's about belly height, about belly button height is a good kind of indicator. In the clinic, I describe this as a 4-way shoulder exercise. And the easiest way to remember it is that you're just going to look at each one of 4 walls and perform an exercise in that motion. So let's go ahead and we'll get started with the easiest one is going to be shoulder flexion. I'm looking away from my anchor. Starting position is right down here at my hip with really good posture. So pull your shoulders back, bring your head up high. You're going to lift that band up until it's just about at shoulder level and then slowly return right back down to the starting position. So I'm going to go nice and slow and in control up and then nice and slow and in control down. Don't let that just rebound back down. Try to control that motion the whole time. This is a great exercise for front delt, also a great exercise for that supraspinatus as it stabilizes through that motion. And usually what I recommend is about 10 to 15 repetitions in this direction. Now what I'm going to do is rotate 90 degrees. I'm looking at you now. What I'm going to do is some internal rotation with this band. Elbow is bent at a 90-degree angle, really good upright posture, and then I'm just going to use my hand to pull that band across my belly button, and then again slowly return back to that starting position. And so we're going to pull just like this. The further away you stand, the more resistance you'll experience. If it's too hard, move a little closer to it. but that's the motion that we're after right there. And again, about 10 to 15 repetitions of this internal rotation motion. Next, we're going to turn and look this way at the wall. This is going to be a shoulder extension. I'm going to grab the band. Starting position is right here out in front of me. Really good posture. And then I'm going to pull with the back of my shoulder until that band comes just about right here, kind of to my hip. So to give you a better angle on it, this is what it looks like right here. So we're going to pull, engage those muscles right in the back of the shoulder, hold for a couple seconds, and then slowly return back to that starting position. And we're going to repeat that for 10 to 12 repetitions. The last wall is going to be this one over here, but because you don't necessarily want to stare at my back, I'm going to perform these with the right hand so that you can see it. This is an external rotation motion. And so once again, I've got my elbow bent to the 90 degree. My starting position this time is across my body. Now what I'm going to do is keep the 90-degree bend, pull with the muscles in the back of my shoulder to rotate out in this direction as far as I can, or as far as pain will allow me to. And then we're gonna, again, slowly return back to the starting position. And honestly, of all the motions, this one's kind of the most important. Usually it's these external rotator muscles that are the ones that need the most help, that need the most strength, and that will result in the greatest improvement when we strengthen them. And so about 10 to 15 repetitions right here, and then I would repeat that series, that 4-way shoulder exercise, I would repeat that 3 times. If you're interested in those exercises to strengthen your rotator cuff with dumbbells, it's this video right here. Here's one more YouTube thinks you might like. If you haven't subscribed to Tone and Tighten yet, I'd love to see you back for future videos. Hit the circle right here to do that. Hope these help you to feel better, and I'll see you again soon right here on Tone and Tighten.